Hello everyone, Chris here. Today we're going to take a little bit of time to look at the Hillrom MetaNeb. The MetaNeb is being used more and more in facilities today. Small volume nebulizer type functions, as well as functions similar to IPBB, as well as some hybrid features where we have an oscillatory frequencies that can be set up to provide vibratory type therapy along with your medication administration. So let's take a look at the setup itself. The MetaNeb comes with a disposable circuit. As you can see, it has an attachment for a small volume nebulizer. We have our Salter's Lab nebulizer here. It has a built-in mouthpiece here, and of course the filter and multiple connections on this end of the circuit. So simply come up to the MetaNeb and you'll line up the three ports and twist. There's some instructions here on the front of that filter to instruct you on how to lock the circuit into place. So once that's done, the MetaNeb actually has an on-off switch here in the top portion of the device. It is pneumatically controlled, but it does have an on-off switch. So we'll turn the MetaNeb on right now, and first off, we're just going to provide a regular type of flow aerosol administration, similar to what you would do with a SVN. So we turn that on and we can adjust the flow. This is the flow control. And as you can see, we've got medication emitting from the nebulizer. And again, we can adjust the flow there and provide a very nice, effective small volume nebulizer treatment. But there wouldn't be a lot of value in that. With the MetaNeb, we can do some additional functions. First off, we can utilize here the lower selection is continuous positive expiratory pressure. So we can provide a pressure against the lung while the patient is breathing the medication. So I'll demonstrate that now. We'll flip the switch over to the continuous expiratory pressure, and then we can dial that pressure in. As we move the dial forward, we're getting more and more flow and more back pressure. So that's one of the features that's very helpful in lung expansion therapy, as well as we can flip the switch back up to the oscillatory or vibratory effect. And with the test lung, you can see how the vibratory effect might transmit the frequency into the lung tissue there and allow that vibratory effect to help with secretion management. That's the fast setting. Here's the slow setting. So two settings, a faster and a slower high frequency type of a pulse. Now we also have a manometer here that while the patient is being delivered the medication, we can see the expiratory pressures and utilize the flow to maximize the pressure that we're administering to the patient. And one final feature here, there's an entrainment device here near the mouthpiece. There's three settings, and you can entrain some room air through the venturi here in three different settings to increase the flow rate. So you do have a couple additional settings there. Normally the MD will order the MetaNeb and the medications, and the respiratory therapist will assess the patient to determine what type of feature would be best for that patient. Are we looking at a patient that has some atelectasis, some lung collapse? Are we providing just a normal preventative type of a treatment? Again, we might have some specific situations where thick secretions, where the vibratory effect might be very, very helpful. So again, the MetaNeb, very helpful, very useful device, new on the market, made by Hillrom. Now the downsides are the circuits are fairly expensive. Most facilities will use the circuits for several days before discarding them. Again, the nebulizers are a standard nebulizer that can be placed on this device. You can use many different manufacturers. You don't have to use the Salter Lab. So I'm going to go ahead and grab the camera and get a little closer to the MetaNeb before we conclude this session, just so that you can see some close-up views of the controls of the MetaNeb. So there are the close-up of the controls. You can see the different high-frequency settings here. Right here from the high, low settings, the toggle switch between small volume neb to oscillatory to regular continuous expiratory pressure there. There is the connections for the circuit as I described earlier. And of course, as we come to the back of the MetaNeb, we're going to see the on-off switch, which is right here, as well as the connection for your source gas. So you don't necessarily have to use air with the MetaNeb. You can use oxygen or air, whichever the practitioner feels is most appropriate. So again, very flexible, very dynamic tool. You're seeing this being used more and more. It's so flexible and can add different aspects to your therapy while you're giving your bronchodilator. So the MetaNeb, I hope that was helpful, everyone. And until next time, be well.